It's an inflammatory disease that can affect almost any organ in the body, but most commonly targets the lungs and the lymph nodes.
Due to the high unmet medical need, there's an urgency for effective and accessible treatment options.
We'll sit down with Dr. Peter Sporn at Northwestern Medical Center to learn more. But first, we'll meet Cheryl, who's been living with this disease for 20 years.
We're going behind the mystery of sarcoidosis.
I'm retired from the New York City Department of Education. I love working out and I love gatherings with family and friends. I started having chest pains when I breathed and when I coughed. I couldn't even do 100% at my job because I was so fatigued and tired. So it was a Sunday morning, I was getting ready for church with my family and I started feeling worse. So I went to the emergency and they did a chest x-ray and also they took a biopsy. And that's when they found out I had a rare disease called sarcoidosis. I didn't know, is my life over? Will I be able to live a normal life? I didn't get any explanation.
Dr. Peter Sporn is the director of the Northwestern Sarcoidosis Center of Excellence.
Sarcoidosis is an inflammatory condition in which the immune system becomes abnormally activated, causing granulomas or nodules to develop, and ultimately that can lead to scar formation in the lungs and other parts of the body. The skin and the eyes, the heart, and the nervous system, including the brain and the spinal cord, can become involved. When sarcoidosis affects the lungs, we refer to it as pulmonary sarcoidosis. Pulmonary sarcoidosis is often associated with symptoms such as shortness of breath, cough, and with wheezing. The disease can progress, and some patients can go on to require treatment with supplemental oxygen and may develop chronic lung problems as a result of the disease. In some people who develop sarcoidosis, the disease flares initially and then subsides on its own. In other individuals, sarcoidosis flares up and requires medication to suppress the inflammation and to improve the patient's symptoms and other manifestations. Some of these patients then can go off medications and the sarcoidosis will remain inactive. Up to a quarter of patients require ongoing, continuous treatment to keep the disease in check and to prevent ongoing inflammation in the lungs or other organs.
Once I got out the hospital, I went to see a pulmonologist and I told him I'm in pain, I have shortness of breath, and I just don't feel well. I was just told that everything was in my head. Maybe I have a sinus drip. I know my body. I know that I'm short of breath, especially when I take a few steps. I know pain. I wasn't even given any medication. I just started going on with my normal life, hoping that this disease would go away.
Sarcoidosis is often difficult to diagnose initially. Shortness of breath, cough, and wheeze are the symptoms that we see in other more common respiratory illnesses, asthma, COPD, or a lung infection. Sarcoidosis can also cause a variety of symptoms which are not specific to sarcoidosis. That is, they can be the result of any number of other conditions as well. And those symptoms can include fever, chills, and sweats at night. Weight loss can occur, and fatigue is very common in sarcoidosis. This can be a very debilitating symptom for patients with sarcoidosis that requires treatment.
So over the next few years, my symptoms gotten worse. I started having a chronic cough, chest pains, and pains throughout my body, and I would have coughing fits for up to 20 minutes to a half an hour. I tried over-the-counter medicines. I tried going to the doctors. My primary doctor, they prescribed me cough medicine and painkillers, but it just didn't work. I started to have scabs in my scalp and little bumps on my eyes, on top of my eyelids, and on my body. And I was going to the doctor to get it treated, not knowing this was also sarcoidosis. My quality of life was getting worse. I felt depressed. I was just so tired and fatigued. I didn't want to do anything. I didn't want to get out of bed. I didn't even want to socialize.
According to the American Academy of Family Physicians, a diagnosis of sarcoidosis should be suspected in any middle-aged adult with an unexplained cough, shortness of breath, or related symptoms. A diagnosis relies on 3 criteria: clinical or radiologic presentation, pathology that shows granulomas, and an exclusion of other diseases such as infections or malignancy.
The symptoms of sarcoidosis can have a very significant effect on the quality of life of patients with the disease. They may suffer from limited ability to exert themselves, which can impact the ability to carry out normal daily activities at home or can limit a patient's ability to work. Patients may be affected by symptoms that are more difficult to quantify, such as fatigue or a sense of hopelessness or depression. It's very, very important for sarcoidosis healthcare providers to recognize the multiple ways in which sarcoidosis can affect patients and to address all of these many manifestations with treatment.
I woke up in the middle of the night having a coughing fit, and I went to the bathroom, and that's when I passed out. I was in ICU with a team of doctors, and that's when they found that I had fungus in my lungs and holes in my lungs. Even though I was sick, I felt a little better, a little hopeful, because I finally found doctors who was taking me seriously and finally getting the care that I deserve.
The drugs that we use to treat sarcoidosis are all designed to suppress the abnormal immune and inflammatory response. These include steroid medications, non-steroid oral anti-inflammatory drugs, and several monoclonal antibodies that target proteins that the body makes that drive the inflammation in sarcoidosis. One of the problems with steroid medications is that oftentimes there are a variety of side effects, and this is a significant burden for patients. All of the medications that we use to treat sarcoidosis target various components of the inflammatory response that is involved in the disease, but what we really need in sarcoidosis is new therapies that more specifically get at the causal pathways in the disease that are associated with fewer side effects, that are more effective, and ultimately that can interrupt the disease and stop its progression. It's very, very important for physicians and other healthcare providers who work with sarcoidosis patients to develop a partnership and to work together to control the manifestations of this chronic illness.
So after I was released from the hospital, I found my dream team. I started seeing a cardiologist, a pain management doctor, an infectious disease doctor, and of course I stayed with the pulmonologist specialist. I take steroids and medication for my heart and take pain medications. Yes, these medications are helping my sarcoidosis, but it also comes with side effects like weight gain, nausea, and drowsiness. As a sarcoidosis patient, my hope is that there will be a better way to manage this condition and manage the disease. I am so grateful for the Foundation for Sarcoidosis Research. It helped me to find information and introduce me to people that's going through the same thing that I'm going through, and it gives so much information on this disease. I volunteer with the Foundation for Sarcoidosis Research. I can use my experiences to help support others. What I learned about myself through this journey is that I'm stronger than what I thought I was, and I fight to live.
For more information on sarcoidosis, visit Excentia.com and the Foundation for Sarcoidosis Research at StopSarcoidosis.org.
And you can always visit our website, thebalancingact.com. We'll be right back.